Okay, so good afternoon for people who are here. I think my apologies to you, Martina. I think people are having problems with the internet. I can see trying to join in, something is kind of happening. But anyway, the most important thing you are here, and thank you so much for your time, on a Sunday, giving your time to us. To be able to listen to you to talk about a very important subject. Just for those people who are here, if people can just leave their emails addresses so that Martina will share with me the slides for the presentation and people can always look at it later on. And so we will start very soon. If people can make sure that they've muted, and then there will be the opportunity to ask some questions at the end. And so I think probably we just have to make a start. And I will be sort of allowing people to come in throughout the whole process. So hopefully Martina is not going to be distracted by that. And so Martina, thank you so much. I think you can start because I'm just aware of the time and then we can talk about other things later. Thank you so much. Yes, thank you.
Thank you very much, Seshu, and I'm very honored to be back again to present to all of you. So hello to South Africa, hello to the UK, hello to Malaysia as well. I'm absolutely delighted to be presenting to you this topic to a worldwide audience. So it's very special indeed. So I'll just introduce myself formally. My name is Martina. I'm a specialist psychologist in the NHS. I specialize in older adult work and dementia care, and colleague to wonderful Zetu. Together, we're working in a multicultural area in East London, and the demographic that we serve are living with high rates of cardiovascular disease and diabetes. So dementia is very much present and on the rise, in fact. So we work an awful lot in dementia with people of all ages, sadly. And I'm one of the psychologists in the team, and together, Zetu and I provide assessment and therapies to older people and people with dementia, their carers and their families. So we've worked in the NHS for many, many years, but I think I also bring my lived experience as well. So I grew up in a household with a grandmother living with dementia, and me and the family supported her for many years and saw the whole experience from start to finish. So I feel like I bring that lived experience as well in addition to my professional experience. So this is, I suppose, the aim of our talk today. So an overview of today's presentation. As I suppose the title suggests, we're going back to the start. We're going to get to grips with what dementia is all about and the different types. We'll blow away those cobwebs. We'll consider what are the risk factors and what are the early signs. We'll think together about the assessment and the diagnosis process. We'll also discuss what the treatments or the interventions are, what is possible. And then if there's anything that doesn't make sense, please stop me, ask questions. I know we'll have some protected time at the end as well, okay? So I'm just going to kind of spend a little time here kind of getting to grips with the statistics, I suppose. I believe the majority of today's audience are in South Africa, but this is a visual to kind of look at the prevalence of dementia worldwide. With South Africa, I believe there's no nationally representative data on dementia at the moment, and there's no routine monitoring or kind of surveillance of the disease and the true figures. And of course, it's complicated as well in terms of what's going on in South Africa with stigma, sociocultural beliefs, the health system. So I guess the figures and the stats that you see here are estimates. And studies look at those estimates and think about the occurrence of dementia in South Africa. But I think worldwide, I think it's safe to say that, dementia is really a leading cause of death, and it's one of the most major causes of disability and dependency, especially in older people globally. You can see there, if we compare the regions of the world, that Africa has lower rates, but again, it's complicated, isn't it? It may be due to the underreporting and the lack of monitoring. And then you can see in Asia that it's quite high, isn't it, compared to the rest of the world? But in parts of Asia, people are living with health conditions like cardiovascular disease and diabetes, which in turn increases the occurrence and the chances of dementia. And then as the awareness increases and hopefully the improvement in assessment and diagnostics too, you can see that the projections for 2050 are incredibly high. So we're really kind of, I suppose, running towards a real kind of health crisis in a way. And I suppose it's about thinking, where can we take action now? So let's think about, brain, brain function, what it's all about. Brain function is very, very complicated. And we can see here in this picture what the brain is responsible for. It really is like a command station for the human body. And the brain carries out a huge variety of tasks every day, things that we totally take for granted. The brain includes, I suppose, responsibility, receiving and processing information about the environment, taking actions based on thoughts and feelings and perceptions. The brain also handles a lot of tasks that a person is unaware of, for example, how fast our heart beats. So, when you see something like dementia coming along, a disease process, it can really wreak havoc in the brain and interrupts lots of lines of communication internally. And if we think about the formal definition of a dementia, it really is a disease process. It's a collection of signs and symptoms. What we look out for as individuals, as families, as clinicians too, we look out for what are the visible signs, like a person having word finding difficulties or forgetfulness or changes in mood. And as a result, they're struggling with their independence and managing their household. And those are the consequences of brain change. So, this change in the brain is structural. It means that disease affects parts of the brain through processes like cell death and change, blood supply issues too. And sadly, as a brain disease, dementia gets worse over time. But it must be said that everyone's experience of dementia is unique. For some, the progression is quite rapid, especially in younger people, while for others, it can be slow, gradual, or even stepwise. And remember, the changes, I suppose, that's associated with dementia is more than the normal aging process can explain. Because after all, as we get older, our brain will change, but the changes in dementia are much more than the normal aging process. Okay. So looking at these slides now, we're really kind of getting to the grips of, I suppose, the internal processes, those disease-based changes. And I suppose some people relate to this because it really makes I suppose, the dementia an illness. It brings a reality to it. As we age, it's perfectly normal to lose some neurons in the brain. People with dementia, though, they are experiencing greater neuron losses. So many neurons stop working or they lose connection with other brain cells, and eventually they die. And here in these visuals, we can see the impact that the disease process has on the brain, which causes dementia. If we think about something called Alzheimer's disease, a particular type of dementia, there's an accumulation, a buildup of protein in the brain that causes a lot of disruption, interrupting communication and neurotransmitter pathways. And this often results in shrinkage, which you can see here in some of the pictures. In Alzheimer's, this shrinkage can be very kind of localized, and it especially hits areas called the temporal lobes or the hippocampi, the memory center of the brain. If we think about another subtype called vascular disease, that means the blood supply is significantly impacted in the brain. And often the person is living with health conditions like blood pressure, cholesterol, diabetes, all of which can affect the blood supply. And in the picture here, you can see that there's some furring of the walls of the blood vessels that results in narrowing of the arteries and the veins, which will affect the flow of the blood. And it will affect blood pressure too, which in turn can lead to things called stroke or hemorrhages in the brain. So essentially bleeds or blockages. So dementia is often subtyped based on what part of the brain is affected or implicated, or what the source of the disease might be. So dementia is an umbrella term. Okay, it represents different types of disease processes affecting memory and thinking and behavior that significantly go on to interfere with a person's ability to maintain their independence and their activities of daily living. As I said a moment ago, the subtypes speak often to the area of the brain affected by the disease process. And we discussed that the disease changes endure, and they result in progressive change, change that gets worse over time. But the crux to a dementia diagnosis is that the brain change affects thinking and memory, which in turn goes on to affect our everyday living tasks. So that is central and crucial to a diagnosis of dementia. There are many types of dementia. In fact, there's over 200 types, but here I've kind of listed the most common types. Each type, each type of dementia will speak to the areas of the brain affected. Those kind of cell deaths are the areas that shrink, in turn affecting how people remember and think and speak. And the most common types across the world actually are Alzheimer's disease, vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. So mixed dementia may, I suppose, have a number of various disease processes unfolding. So there might be vascular change, there might be changes in the blood supply, but there may also be kind of protein change often seen in Alzheimer's. So sometimes we see, I guess, two disease or maybe even more multiple disease processes playing out. However, Alzheimer's disease is the most common form of dementia, and it does contribute to about 60 to 70% of cases across the world. And here is a breakdown of the different types of dementia. Okay, so symptoms will vary from one subtype to another, but as I've kind of alluded to, mixed types may kind of speak to various patterns, okay? Where Alzheimer's disease might affect memory problems and word finding, something called frontotemporal dementia might bring difficulties with emotions and behavior, as well as thinking and memory problems as well. So the part of the brain affected can often determine how the person thinks and acts, okay? This is probably an oversimplification of how, the presentations of people are, but this is just purely here for learning, okay? And as I said, there's often crossover, so you often have kind of a mixture of various symptoms, and that's often reflected in the different processes that might be kind of breaking down in the structures of the brain. And you're probably wondering, like, why would we even subtype? Why would we make these kind of differentiations in the diagnosis around dementia? it sometimes feels like it's oversimplifying, and a person is much more complicated than this. However, we do sometimes need to know the type of dementia in order to know how to support the person. And that may come in the form of prescribing a particular medication, or it might come in the form as well of supporting the type of thinking and memory problems and behavioral issues that the person is presenting with. So it is sometimes useful to think about what kind of type of dementia is the person living with. Now, I think it's important to kind of take a note here and be aware of what are the contributing risk factors for dementia. I mean, this research is evolving, but it's incredibly important in, I suppose, health promotion. Researchers believe that there are many risk factors that play a role in dementia, including genetics, behaviors, and habits. And it's important for us to know as health professionals what are the risk factors, because often most of these are quite modifiable. We can change them, we have control over some of these things. Some risk factors, such as age and family history, they may be set in stone in a way, and they influence how the disease process unfolds. However, there are many risk factors that can be changed and that can be kind of, I suppose, manipulated in order to reduce a person's risk of cognitive decline. Habits like smoking, alcohol use, obesity, even social isolation, all of these are changeable. We can intervene early. This is why it's incredibly important to know about risk factors, because it informs our dementia awareness, our healthy living, education, promotional efforts. So we need to start thinking about how do we intervene at an early stage, getting the word out about these risk factors and doing something early before the disease process unfolds. And of course, age is the main risk factor. And as I said earlier, as the brain ages, it does become more vulnerable to change and disease. Some people do come, though, with genetic influences, although it is more rarer compared to maybe the risk factors associated with lifestyle. Some subtypes of dementia, especially those called frontotemporal dementias, are actually quite genetically loaded, and about 30 to 40% of these cases have a genetic kind of component to them, and they're often known as familial. That means family related or genetic related frontotemporal dementia. I think another interesting stat as well is women have a higher risk of developing dementia during their lifetime. I suppose, yes, women do live longer. However, there is research now which suggests that there might be unique biological reasons as to why women are more susceptible to dementia. And I think there is particularly interesting research around the hormonal changes that women are subject to, especially menopause, and how that can increase risk to dementia. Vascular risk, I have to say, is a really, really big one. And that's something that Setu and I see an awful lot in the population that we serve. Basically, what's bad for the heart is bad for the brain. So conditions like blood pressure, cholesterol, and diabetes will increase our risk for developing dementia. And a combination of risk factors such as genetic, individual lifestyle, environmental factors, that will significantly increase the chances of developing a dementia. So awareness at the earliest possible moment is absolutely essential. And I suppose it's important as well for us to think about, like, what are the red flags? What are the early signs of dementia? The things that we need to look out for and which may prompt action. A person may suddenly be making poor financial decisions, for example, and that might seem out of character. So looking out for things like that, or someone's ability to manage their emotions, for example, might be something to look out for. The person might become snappy or impatient, and again, that might all feel very much out of character. So here is a list of some of the signs and symptoms that we look out for, which might need some attention by a doctor or a clinician to try and, I suppose, start the process of investigating further and seeing what might lie beneath these early signs of dementia. And I suppose you might ask, well, what's the point of a diagnosis? Why is there a push to have a timely diagnosis of dementia? Well, we argue that it's important to have the news of a dementia in order to enable people to gain access to support and resources for themselves and for their family, as well as to maximize the quality of life and allowing for planning and allowing for a future that's within the person's control, really. People feel that they do have control about what happens to them, especially if they can make decisions in the early stages of the dementia. And we want to empower choice. That's incredibly important. An early diagnosis also means that interventions become more effective. So they really help to kind of manage and stabilize the thinking and memory problems. But easier said than done. A lot of barriers can be met along the way. A person and their family may encounter barriers like denial because it's so painful to admit that something might be going on with thinking and memory. Stigma, I think we had a very interesting talk a few weeks ago about that. So that's a real challenge for the person with dementia and families. Poor awareness, just not knowing exactly what might be going on and how to act upon it. And also misdiagnosis. So medical teams may not be fully aware, especially of those subtle changes that might be in the early stages of dementia, as well as those rarer types as well of dementia. We often see that people become misdiagnosed and it really kind of confuses the journey and experience to a formal diagnosis. Also, for example, we see people often get misdiagnosed with depression when actually there's something else, there's something more going on behind that. So training and development of, I suppose, not just the lay person, but also professionals is incredibly key in ensuring that we see and diagnose people in the early stages so our interventions can be more effective. And when we think about getting the assessment process started, it really is essential that we get off to the best start. We want to try and rule out reversible causes because there are many, many things that can cause what might appear like a dementia. Many, many physical changes, in addition to kind of changes in our mental health, can actually bring about thinking and memory problems. And the clinician that we go to should be asking, is there anything physical or emotional that can be causing these changes in thinking and memory or behavior or mood? So blood screens are really important to carry out. We can look at I suppose, the blood screens to see if things like vitamin deficiencies might be causing some brain change. So, for example, low iron can cause changes in our thinking and memory. So it's important that that low iron is detected by a blood test and then the iron supplement is administered, which may actually cause that reversal in the thinking and memory problems. If people are prone to infection, that needs to be excluded too. So, for example, urine dips are used to detect if there's any infection in the system, because as people get older, some are very prone to urinary tract infections, and that's a really big one to exclude. Pain is also something that we see an awful lot. Pain can cause attentional problems and memory problems, and that pain should ideally be addressed with medication or support before we then proceed further, probing if a dementia is happening. Mental health difficulties like stress, depression, anxiety, that needs to be assessed for as well and treated before we proceed with a formal assessment. If all of these issues are addressed and the thinking and memory problems persist, then we know we have the green light to go ahead and carry out the formal assessments around thinking and memory. If the treatment is not carried out beforehand, it means that our assessment isn't very reliable. And as Setu and I are part of specialist services, we work in a very multidisciplinary way, but we're very aware that services for assessment of dementia across the world are very variable. Some clinics are run by single clinicians, whereas others are multidisciplinary, like the way Setu and I work. In our memory clinic, we start by speaking with the person and their family, and we gather as much information about physical health, about thinking and memory, about mental health, about the family setup, before we proceed with formal testing of thinking and memory. Assessment of thinking and memory establishes the working of the brain. We request brain imaging, which tells us information about the structures of the brain. So we bring and piece all of this information together, in addition to maybe additional investigations carried out by neurology or occupational therapy or neuropsychology, a more in-depth assessment of thinking and memory before we have that conversation together as a team. And that conversation is incredibly important because the multiple perspectives from different disciplines, I suppose, leads to a more accurate diagnosis of dementia. And then we can make that final conclusion, which we share with the person and the family, breaking the news about what the conclusion is. And of course, this is a very difficult time. It can bring shock, it can bring upset, because it is a considerable adjustment to make. After all, this is a progressive condition. But it can also bring a sense of relief, because people may wonder for many years what might be explaining these changes in their loved one. And this is the moment which does offer that explanation. Sadly, there is no cure for dementia. However, there is a major focus now to make life meaningful, purposeful, and satisfying. And that is something that's incredibly important and a passion of ours to Setu and I in our work. And it is about encouraging, I suppose, the person to look after themselves physically and mentally. And the family around the person maintaining that is incredibly important. And broadly, there are different types in the approach to intervention in dementia. There's one which is very medication focused, pharmacological, or the one that we really champion is the non-pharmacological, the kind of the social, the emotional, the psychological ways of keeping the person well and living well with dementia. There are medications available, but it must be known that medications do not cure the illness. The medications are purely designed to enable the neurochemicals and the neurotransmitters in the brain to communicate and travel more effectively. And in addition to that, only certain types of dementia can be treated with these drugs, mainly Alzheimer's disease, mixed types of dementia, and Lewy body dementia. Vascular dementia is contraindicated for these drugs. This means vascular dementia is not suitable at all for the drugs because these medications, like most, come with quite, serious side effects, especially for someone who's living with a heart condition. So that means people with vascular dementia are not suitable for these medications. Now, the research says that there is only a modest benefit of taking these drugs. The strongest research actually says that a stimulating environment with exercise, good diet, brain training, music, that program can be more effective than these drugs. So please don't feel disappointed if you don't have access to this kind of treatment. It's actually more common than not. There is some, I suppose, what we call psychiatric use of medications, but it's only offered to people who are, I suppose, in major distress and are at risk of harming themselves or others and are incredibly agitated. So the guidance in our country is to not use psychiatric drugs, and it's the last resort because they can be physically harmful to the person with dementia. And we would always encourage the behavioral approach or the emotional approach to address the distress before we even resort to medications of this nature. And I suppose the question is, what about people living with vascular dementia? I mean, where is the treatment there? So what's good for the heart is good for the brain. And essentially, the treatment for vascular dementia is really carefully managing those risk factors like cholesterol, high blood pressure, diabetes, and being very focused on diet and lifestyle. Okay, so that's essentially the treatment or the medication for vascular dementia. So, with those kind of medications aside, let's now focus on, I suppose, the non-pharmacological approach, the behavioral approach, the psychological approach, the emotional and social approach. And this is where our passion lies. This is what means to be, I suppose, offering that high quality of care and lifestyle to the person with dementia. It means that this type of intervention and treatment in a way is accessible to everyone. Okay, it doesn't cost anything. There are changes here that we can make that offers, a meaningful and purposeful life to people with dementia. Okay. So in the next few slides now, I'm going to break these points down and hopefully you can get some ideas about, I suppose, how to adopt and apply some of these ideas in your own life with your loved one. So research says that regular physical activity is really helpful in reducing the risk of dementia, but also managing it too. It can even go about preventing it. That's what some of the research is saying at the minute. And there are so many benefits from physical activity. So improved mood is a really important one. There is that sense that exercise can improve overall well-being and make people feel more positive in themselves. You might be thinking, well, my loved one is confined to bed or they're in a wheelchair, but there's chair-based approaches that work incredibly effectively, okay? Exercise has also shown to improve memory. because it can, I suppose, increase the blood flow to the brain, which in turn will activate pathways and cell health, and it can improve memory and reduce the rate of disease-associated mental decline. Exercise also goes on to improve our strength and our balance, and it can actually help reduce the risk of falls. So this is, again, is a very preventative approach. And as I've already alluded to, improved cardiovascular fitness is incredibly important for brain health. So that's another advantage of why it's really important to integrate physical activity in any way you can. And it doesn't have to be fancy. It can be simply doing some housework to walking. So really thinking about where can we factor in physical activity for people living with dementia. And again, that message is what's good for the heart is also good for the brain. Okay, so, physical exercise is really important to that because, of course, it's about encouraging that nourishing, oxygen-rich blood supply to the brain. Okay, and managing all those health conditions because of exercise. Now, nutrition is really interesting, and there is an awful lot of research now emerging about this, okay? Many studies are suggesting that what we eat affects the aging brain's ability to think and remember. So the findings have led to research on general eating patterns and whether a person's diet might actually make a difference. And it's possible that eating a certain type of diet affects biological mechanisms in the brain, like oxidative stress and inflammation. These kind of things affect the dementia disease process in the brain. And research is now saying that eating a certain diet, which increases specific nutrients, may be protective, right? To prevent those to prevent the inflammation and the protein accumulation in the brain, often associated with some dementias, okay? Especially Alzheimer's disease. Now, some of these studies are observational, okay? Not, I suppose, not fixed yet, but it does show that the Mediterranean diet is often associated with a lower risk of dementia. And there's an awful talk at the moment of like what is known as ultra processed foods. So foods with loads of additives, foods that have been really changed because of the factory process. Often they have chemicals, and there's some research at the moment which is saying that these, I suppose, manufactured chemicals are interacting with processes in brain function. So if we can reduce our use of ultra processed foods, it's to better brain health. Okay. And that means avoiding those processed foods, those saturated fats, and thinking about lots of fruits and vegetables and maybe some whole grains, carbohydrates that are really important for our brain function. So this is a really interesting area of research at the moment. And again, these are changes that we can make every single day. Just being very careful and choosy about the kind of food that we give to people living with a dementia. Now, this is a real interest area to Zetu and I, mental stimulation. Again, the research is big, so there's loads and loads of studies which show that people doing meaningful, mentally stimulating activities have a lower risk of decline when they're living with dementia, and even lowering the risk of chances of developing a dementia. So maintaining meaningful, purposeful activities adds value and quality to a person's life. And if a person is diagnosed with dementia, their strengths and their abilities will vary a great deal. So I suppose being adaptive to the activity and making it meaningful and purposeful to the person is incredibly important. So this is an area again that we have control over. What can we involve our loved ones in? Okay, from puzzles and games at home to activities around the house. It could be something like folding the clothes or cooking and baking. These are all meaningful activities to the person. It gets them involved and it gets them using various brain parts at a very sophisticated level, something that we really take for granted. Alongside that is socialization, being socially connected. It's so important that the person with dementia feels part of family, of community, of society. Because again, research says that isolation and exclusion can be very damaging. And we saw that very much in COVID, where that person living alone, especially, actually the dementia accelerated. It picked up by speed because the person wasn't socially connected and stimulated and enriched by being surrounded by others. Okay. So here are some of the ways to, I suppose, support the person with dementia in a social way. Include them in social activities and events. Encourage them to join in conversations. Just calmly remind them of what's going on, what's the conversation focusing on, making eye contact when they're talking or asking questions. They may say something unrelated, but maybe not embarrassing them, involving them, or maybe redirecting the conversation, just acknowledging their contribution. When my grandmother was in her late stages of dementia, she wasn't very much able to make conversation at all, but actually sitting around the table, being amongst the rest of family and friends, really enriched her life. And it does make a massive difference. Those kind of social, enriching environments is a very important aspect of keeping the dementia as stable as it can. And I suppose taking an attitude is really important as well. Although it's easier said than done. I mean, looking after a loved one with dementia can be incredibly demanding and stressful, in addition to everything else that's going on in life. But, rather fighting the dementia, sometimes it can be a bit more adaptive and healing to accept it. It takes less resource, it's less exhausting to fight the dementia. And I suppose focusing in on really what's in your control. We cannot control the rate of the progression, sadly. There are things that we can do to kind of manage and stabilize, but we can control what kind of food we offer, the kind of activity we provide, the type of music we can play, all to bring a quality of life to people with dementia. And it's totally understandable, both for the person with dementia and carers, to have emotional responses and changes. It can be a total roller coaster in managing the news of a dementia and the various stages of dementia. But it's really important that stress levels are controlled for everyone involved, although it's easier said than done. It is well known that stress can really exacerbate or make the thinking and memory problems a whole lot worse for dementia. So, trying to create a relaxed and calm and organized environment is incredibly, incredibly important. And often carers as well are managing incredibly stressful and challenging situations. And they often come to us and ask, am I developing a dementia too? Because I'm not paying attention, I'm not remembering things. But that's the negative impact of stress. Stress can bring lots and lots of challenges to how we think about things, how we remember things, and it can really take a toll on our thinking and memory capacity. So it's incredibly important, to try and reduce stress wherever possible. And as a carer looking after a person with dementia, it's incredibly important to have a few minutes to yourself, because you do, I suppose, worry about what happens if you do not look after yourself. Well, you're not able to look after the person with dementia. That is the big question I ask my carers. So it's so worth investing in looking after yourself. Otherwise, the consequences are great. Okay. And here, this is just a little overview of the different types of self-care that you can engage in. How can you look after yourself physically? Thinking about checking in with your lifestyle, your health. Is it being supported? Can you do things that can, I suppose, relax you? Your emotional health, being compassionate to yourself. It's absolutely perfectly normal to get things wrong, to make mistakes, but it's all about learning from those. Okay? And having some compassion and some forgiveness towards yourself is incredibly important. And often the carers that Setu and I work with can be incredibly isolated because all of their waking hours is supporting their loved one. So it's really important to be connected to other carers, like we are connecting to one another now. You have a sense that you're not alone with this, and that there are other people in your shoes who have the same lived experience as you. And in that space, you can offer your own experience, your own expertise, helping others out, but also learning from others as well in their journey with dementia. And then there's also the spiritual aspect as well. So people take a lot of comfort in their religious beliefs and connecting to the spiritual side of their life. And that brings some calmness, it brings some relaxation, it brings a sense of space and time for oneself. So again, it's about really noticing those kind of aspects of self-care. What can you do to your own kind of life? What change can you bring in order to make your caring role a little bit easier? I know we began this, I suppose, presentation today, really kind of honing in on the disease process, the changes to the brain that happen in dementia, but we have to make it known that the person is more than a brain. They are a human being, they are a person. And I know it can be very difficult at times to see the person and not the dementia, but the person with dementia has had a rich and lived life, and potentially they can have that rich and lived life right until the end. And that, I suppose, poses a big challenge to us as family, as friends, as professionals, to the person with dementia. It's our responsibility as carers, as family, as professionals to ensure that the person can continue a rich and meaningful and varied life that offers purpose. It's a really big responsibility and a really big task. It is our job then to carry the person's personality, their wants, their desires, and to, I suppose, enrich their life as much as possible. And I'm speaking here to Tom Kitswood's needs flower. Okay, so having occupation, having meaning and purpose in the person's life is really important. Having that sense of community and inclusion, being part of something like the person has always been part of, that should not end. attachment, relationships are so important in the person's world. That attachment and security and safety will be very much needed in the later stages of dementia. And a central part of attachment is love. And of course, that is central to everything we do with our loved ones. Respecting the person's sense of identity, that person was a housewife or a mother or a nurse or a doctor, that will not change. So really celebrating and honoring those amazing achievements in the person's life is really important throughout the journey of dementia. And then with the distress, bringing comfort in a timely way, if we can, to kind of ease the distress and making, I suppose, the environment and the world around the person as easy as possible to navigate so it doesn't, I suppose, contribute to their distress or confusion in any way. So these are really, I suppose, the important aspects of dementia care in a way, providing that rich quality of life to our loved ones when we take care of them. And this is important as well for carers living with dementia, thinking about what they need to do for themselves to look after their loved one with dementia. So this brings us now to the end of our talk. I would be absolutely delighted to kind of hear your thoughts and reflections, and also to take any questions if you have any. Okay?
Wonderful. Thank you so much, Martina. What a wonderful presentation. And I'm hoping that people who are here can say something, because I think in South Africa, there's a problem with the weather. So sometimes it does affect the internet, but it also gives us the opportunity to be able to ask questions, because there's not going to be many people around. And I think also Madanda will be saying something anyway very shortly. But I think for me, what we also have to remember is that I think every time I always say how lucky I am to be working alongside people like Martina and Michelle. Michelle presented something last week. There is so much that we share in common, and there's also a lot that we learn from each other. So I think to be in that environment where you are surrounded by people who are so passionate about making a difference in people's lives, it actually helps me to do much more for people in South Africa in terms of raising awareness and making sure that the carers are empowered. Unfortunately, we are living in a country where the dementia services, public ones, are non-existent. And you talk about even diagnosis, people don't even know much about dementia, so they're not likely to go and access any kind of support in hospitals for diagnosis. So there's a lot that we need to do, but I've always believed that if we as people can learn from each other and not expect the governments or other people to do it for us, but if we can come together, support each other, learn from people, who have the knowledge, and support each other moving forward, because that is the only way. If we are going to wait for the government to do something, it's wonderful if they can, but in South Africa, that's not likely, because there's a lot of other things that are going on in South Africa that maybe the government does not view this condition as a priority. But I think it's upon us as people, to have access to this information that you share with us, to learn from each other, go out there in the community, support other people, but also look after each other and ourselves. So on that note, I'm going to stop, and thank you so much again, Martina. And we are going to have questions. Matanda will be saying something now.
Good afternoon and good evening to those who are far away from South Africa. Thank you so much, Dr. Martina. And I've always, since I've been with BMF, learned and continue to learn so much from your presentation. And also we're so glad that even at BMF, Bessie Makatini Foundation, we have your book, And I love that book because it's so simple. It's so simplified and how to help someone with dementia.
Well,
But
thank
I just
you.
wanted to add, um, especially the big fives, for me, the mental stimulation part that I know that Zetu and yourself, this is like your baby.
It is.
But sometimes it is so difficult. I mean, being at BMF, at the office there, it's been so difficult to get people to come to the office so that we can help them, though they live, people living with dementia and the carers, help them with that stimulation. I mean, we do, I mean, maybe the last 2 months we've been having one or two people coming to BMF. We do quite a lot of reminiscing therapy. We do a lot of stimulation.
Oh,
We just
wonderful.
have a lovely sensory garden that I had to learn about it. We have a garden, and when people come to a BMF, it's not only that we sit and talk, but we do activities such as singing, dancing. That's my favorite. Um, so just as we have mentioned that it's just to help them to lower the decline, but to get those cells, active. But sometimes the families, and I'm so sad that some of them they're not here, they they still don't understand why do we have to come together as carers and people living with dementia so that we continue with the stimulation. And I was talking to one lady where I asked them to do, it's like, this is me. I need a life history. Bring me her album uh, so that I can just ask, who's this? Where were you? It's things like those. But how can I? I know Zetu will laugh at me, but how can I encourage these families
Mm,
to understand what we are actually doing, and it's so beneficial to them, and also to prevent those barriers, that stigma, that depression. If you see another person, oh, here's another family that's living with dementia, you feel much better
yeah,
than thinking in your own box at home and think you are alone.
yeah.
Yeah,
It sounds like, oh, it's such a rich and varied program that you offer. Reminiscence, the sensory garden, the life history work. It's absolutely beautiful what you offer the people with dementia and families that you support. And I'm really sad to hear that they're not able to come and spend time with you. Is that because of transport links and getting there? Are they able to come to the office?
yeah.
They're able to come to
And
the office.
some of them, we are in a city or a location that's called Lamontville,
Mm-hmm.
and some of our carers or families living with dementia, they are outside the area. So transport will be an issue.
Mm-hmm.
Though even some that are in the location, sometimes, people living with dementia, they'll tell you that I'm not going out.
Yeah. Yeah.
They can resist. So it's a mixture of all those.
Because even
But I
we
mean,
have
we will
that.
have one or two.
Yeah, okay. And do you think it's about the stigma then, or what about the expectations perhaps of carers? I know that for some carers we work with, they think that, oh, I'm going to take my loved one to the professionals and they're going to do the work. They will do the fixing. And, we as family, yeah, we take a back seat. I think sometimes our work is to kind of manage those expectations, because that's not realistic or sustainable, is it? I'm just wondering
Yeah.
if there's something about attitudes again, and expectations from, from you guys, that sense that, you know, it's over
Mm.
to the professionals here. Let them do the work with my mom or dad or aunt, and it's not down to us. I think sometimes those attitudes can get in the way of access.
Mm.
I agree with you. I think for me, stigma is still a big issue. And I
Yeah, the
think
association.
we live in a society where, we struggle with those issues. Even though people but maybe they're not convinced, they don't
Yeah.
understand why we're trying to do this. But I think, I'm going to introduce